Here's my delivery outline guidelines. Here's my audience. Today, I will be talking about the rise in mental health illness and substance abuse in rural areas, specifically Springfield, Tennessee, where I live. According to Dr. Paul Mackey, 60% of rural Americans live in a mental health shortage area. For example, in my hometown, we see daily people walking the streets, and we know quite a few homeless people are living in and around the parks in our city. My husband works for the Parks and Rec Department for the city of Springfield and sees this daily. One morning, he and his co-workers were at the dog park and found people sleeping in the park. Unfortunately, with their policies, they had to call the police and have them barred from the park. The scarcity of resources and personnel is practically non-existent in my area. I Googled looking for mental health services in my area and only found one, and that being Centerstone. The National Rural Health Association has what they refer to as the 4 A's of mental health. According to them, these are the 4 reasons for a lack of mental health services in rural areas. These are accessibility, availability, affordability, and acceptability. The difference here between accessibility and availability is that availability measures the extent to which the provider has the requisite resources, such as personnel and technology, to meet the needs of the client. Accessibility refers to geographic accessibility, which is determined by how easily the client can physically reach the provider's location. According to the American Psychological Association, the number 1 reason why people do not get mental health services is that they can't afford those services. Many people do not obtain mental health services because they are also ashamed or embarrassed to receive these services. No one really wants to be labeled as crazy. I have given some reasons for the rise in mental illness and substance abuse in rural areas. Now I'm going to tell you about some solutions. Telehealth has come about and is becoming more available to make it a little easier for those without transportation. We do have a fast-paced urgent care facility here in Springfield that is slowly adding more providers other than just family medicine and your quick urgent care needs. They now provide mental health services, but again, you must have insurance or be able to self-pay. The Tennessee Department of Mental Health and Substance Abuse Services are another outreach. If you qualify for TennCare and find a provider that will accept it, you can get help a little easier with that. We are needing more faith-based programs. One night a week, Celebrate Recovery is offered at the church we attend. Christian counselors are slowly starting to come into this area, with the first one being Mighty Oak Christian Mental Health Services. In conclusion, today I hope I have shown you why people do not receive mental health services and just how much the need for more mental health services are needed in and around smaller communities to provide help to those who are less fortunate than others, and the need to spread awareness so others understand mental health issues and remember it is okay to ask for help and not to be ashamed if you find yourself in need of a mental health service. Thank you.